I'm going to ask each participants to introduce themselves. So Jodie, first, over to you.
Assalamu alaikum everybody. So my name's Jodie Wozencroft-Ray. I am a CBT therapist. I also use compassion focused therapy and Islamic psychology, and I specialise in working with neurodivergent adults.
Amazing. Thank you so much. Myra.
Hello, Assalamu everyone. My name is Myra Khan. I'm an accredited counsellor, supervisor and trainer, and author of Working Within Diversity, Anti-Aversive Practice in Therapy and Counselling.
That's great. Thank you so much. Just a reminder to everyone, please do keep yourselves on mute. And Tyra.
Assalamu alaikum everyone. Hello. Diary Yassine. I'm integrative counsellor, accredited as well, supervisor. I work with trauma, many other places as well. And I also have a directory, which is called the Neurodirectory. So welcome everyone.
Amazing. Thank you so much. I'm really excited for this conversation. So we're going to kick off by asking, what is neurodiversity or neurodivergence, and what kind of language should we use for people who are neurodivergent? Myra, I'll come to you with that one first.
Yes. So the term neurodiversity, so make that really clear. The term neurodiversity is the name or the label that is like a category label for all the different ways in which our brain works and functions. And the best way that I can describe it is, if we think of the label colour, colour is the label given which will include all colours. So in the same way, and I've got a little prop here to kind of explain this. So we've got here like a selection of different coloured pens. And so all of these pens would belong under the category of colour. And within them, within these pens, then all of the colours then would come under that label of colour, as I've just said. So in the same way, when we think about neurodiversity, it would be the equivalent of saying colour. And so all of us would be one of these pens, essentially, under that label of neurodiversity. Where people get confused is they substitute the word neurodiversity for the word neurodivergent. So the distinction then being, so neurodiversity then is the colour and it includes everybody. So these collections of pens then would be all of us under that umbrella label of neurodiversity. Neurodivergence then would be thinking about neurodiversity as a spectrum, or as a kind of a collection of people's brains, essentially. And depending on how your brain has been wired, depending on how your brain functions, under that label of neurodiversity, you would either be identified as being neurotypical or neurodivergent. But both categories or both labels come under this umbrella term of neurodiversity. So all of us will fall under the label of neurodiversity. And within that, we would either be labelled then as neurotypical or neuronormative or neurodivergent. That's kind of my best way to explain it.
That's a great answer. Thank you, Myra. I think that helps a lot of people. I think it can be quite difficult to know how to say, I think a few years ago, we were encouraged to use language like the spectrum and things like that. So has that evolved now, that language?
It has, in the sense that what we're recognizing, we're starting to see neurodiversity fully, that includes all of us, as part of our wider intersectional identities. Because the moment we reduce it down to a spectrum, we then are very much talking then about that's who this person is all they are in their entirety. And the other difficulty in thinking about spectrums is we are then wanting to say or place people on a spectrum in which we say, oh, I'm a little bit ADHD or I'm a little bit OCD. And that's also where we get into these problems and difficulties of thinking then that, how can I put it, that if we're saying things like, oh, I'm a little bit OCD or I'm a little bit ADHD, I think it takes away from people that are genuinely neurodivergent. So I think we're starting to really challenge how we see neurodiversity as something that we all fall under that category. And then when we're looking specifically at people who are neurodivergent, I think we're starting to see it in a much more kind of holistic approach alongside other aspects of our identity as well.
Interesting. And anyone can comment on this, but does mental health and mental illness fall under neurodivergence, or is that separate?
I think it depends on who you ask. So a lot of people would consider OCD, bipolar, schizophrenia as neurodivergent, but then other people wouldn't because they see it from a disorder-specific kind of medicalised way of seeing things. A bit like what Mary was saying, this idea of being on the spectrum or being more or less, it's a bit like saying you're less autistic or you're more autistic, and it's problematic. Whereas neurodivergence is the idea that you just don't necessarily fit into that mainstream neurotypical.
Absolutely. There's definite an overlap when it comes to mental health. So sometimes you won't even know that you're neurodivergent. And maybe later on in your life that you realize that your symptoms are because of you being neurodivergent. So, you know, the trauma may come first, or the disability may come afterwards. So, yeah.
I think the problem with, I think not the problem, but I think the challenge, I think I completely agree with what both Jodie and Tyra said. I think where the challenge has been, or where the discrimination has been, is to, again, substitute neurodivergent for mental illness. And therefore then to say that everybody or anybody who is neurodivergent, that the neurodivergence itself is a mental illness, or that person is automatically has a mental illness or mental disorder. And I think we're starting to get far more nuanced in kind of picking that apart, and not just automatically as one equals the other.
Yeah. Thank you very much. So the next question we have: how do you see neurodivergence through the lens of a Muslim perspective? Jodie, I'm going to come to you with that one.
I found this question really interesting because it's not something I had questioned before. Because to me, in terms of Muslim or Islamic perspective, we were made all different to know each other, and that includes in terms of our neurotypes as well. So the idea that it wouldn't be considered in part of a Muslim perspective puzzled me. I know sometimes in certain communities there can be some shame and things around diagnostic stuff because of the medicalised kind of disorder language that's used. But to me it's part and parcel in terms of how we think about the variety of the world and humans in it.
Very interesting. And, you know, I think sometimes we do see the stigma of mental illness within Muslim community. Is it the same for neurodivergence and neurodiversity?
I think it can be, especially if people see neurodivergence as something to be cured. But that's like saying I'm going to rewire the veins in my arm. I can't do that, just like I can't rewire the structure in my brain. That's the way it is. That's the way it's always going to be. But I think if you treat it that way, that it is something to be cured, that it makes sense that people are quite worried about diagnoses, or worried that people will find out there's a diagnosis or potential of a diagnosis, that you're not normal. And essentially it's just like I say, you can't rewire the veins in your arm, you can't rewire your brain. It's just the way that it is.
Yeah, I like that saying. You can't rewire the veins in your arm, the veins in your arm, and you can't rewire your brain. Little tongue twister. Does anyone else want to come in on the Muslim perspective, or looking through the lens of a Muslim perspective?
Tyra, did you want to say anything on that? I again completely agree kind of what Jodie was saying. I think for me, as somebody in my lived experience, but also in my work, spends a lot of time talking about diversity, I think for me it's recognizing how do I experience spaces, and which of those two identities is being pulled into kind of a dominance, or which one is at the forefront? And I know previously when we've spoken as a group that it's this idea that if you go into neurodivergent spaces, we are then our kind of faith and our Muslimness is kind of then minoritized in that space. And then we can go into Muslim spaces for which the neurodivergence part of our identity then is the minoritized part. And so I don't think it's so much seeing my neurodivergence through an Islamic lens. I think it's about understanding that there is a relationship between those two parts of my identity, as they are also in relationship with the rest of my identity as well. And I often talk about or describe identity as like a Rubik's Cube that gets configured and reconfigured in every situation we're in and in every relationship we're in, depending on which aspects of our identity are at the forefront and what's being called upon in our identity. So, but absolutely, when our faith holds such a prominent foundation to our identity, to our culture, to our lived experience, to our daily routines and rituals, and it offers us those values and belief systems and like our moral and ethical compass, we can't help then but see and hold, or I certainly can't see or hold my neurodivergence then as anything other than this is how I've been made. I am who I was meant to be. And I think there's something then again about honouring the diversity amongst all of us, and rather than holding or sitting in shame for how I was made. And I think faith plays such a strong part in us being able to show ourselves that self-compassion and that self-care and that self-worth, rather than beating ourselves up for not falling into that kind of neurotypical position. I think faith can offer us so much when it comes to that self-compassion for ourselves and our identities.
No, absolutely. I think absolutely, Myra and Jodie. And I think when we all met together, it was such a aha moment. Like I'm not the only one. And then the moments of, there are others like us. And for us to come out and say, yes, I am neurodivergent. I'm very openly say that I'm dyslexic. Jodie took hers, Myra as well. So it's just the space to be able to just bear witness and to say that this is who I am. I'm different. So
thank you. Thank you for all the questions, comments in the chat. I'm writing everything down and we will go through them later. The next question, Tyra, I'm going to come to you. Is it important to have a formal diagnosis or just to self-identify?
I think it really depends. It's a double-edged sword kind of thing, because for many, especially Muslim women, especially Muslims, we are diagnosed very late in life. You go through life, the education system, and it's almost like we're not seen, heard. If there is an issue, it's English might be your second language, or you're just very extroverted. It's never put down to the potentially ADHD, or if you're making spelling mistakes, again, it's put down to cultural nuances that have gone through. So really important to make it as a personal choice. Yes, it does help. It gives you that identity. It gives you that jigsaw piece that you've been always looking for. It's also the clients that come, it's almost like it really made sense when I got my diagnosis. But then again, it's really up to you guys. I mean, what do you think, Jodie and Myra? What would you say on that topic?
The diagnosis is an interesting one because I think it's a privileged position to have access to it. And I know we'll go on to assessment and diagnosis a little bit later, but depending on where you are in the country, you might just not have access, whether you're under 18 or over 18. I know, for example, in the area that I'm in, that an ADHD diagnosis takes a few years, an autism diagnosis, depending on where you're referred to, can take from weeks to years. So I think it's a privileged position. I think the other thing is, if you are self-identifying, that is part of the journey to going towards diagnosis anyway, because people will self-identify before looking at diagnosis. if you can't access diagnosis, self-identifying is absolutely fine, as long as it means that you get to live a life that works better for you and your brain. And if you want a diagnosis and you can seek that, then great, you're in that privileged position, so go for it if it, will help you in your journey.
Absolutely.
And Tyra, where would you go for an assessment or a diagnosis?
So the first
Does it
place,
depend on age?
absolutely. The first place would be your GP. And if you're talking about age, obviously, if you're at school, then you can, contact the school. If you're at university, universities are quite good places to get the diagnosis. I myself was diagnosed quite late, and it was while I was in university studying, struggling because it was almost like being pushed out of the institution. And I thought, no, I need to find out why this is happening, what's going on. And then I went and got my dyslexia diagnosis from the university. But you can definitely go to the GP, you can get it privately diagnosed. There is the right to choose. So you've got many psychiatrists that come under the right to choose. It's very expensive. If you're with the NHS, it is free. But like Jodie said, it's a waiting game, and also the privilege of where you live and how you can get diagnosed in that way.
So it seems to be a bit of a postcode lottery.
Absolutely.
Thank you so much. Myra, I'm going to come to you for the next question. How do we stop misinformation around neurodivergence? And I think this can sometimes lead into the point about self-identification. If you're seeing things online, we see it all the time. If you like to line things up, then you've got OCD, and you see that kind of things online. So what's your views on that?
The starting point for me when I think about kind of recognizing misinformation or how we stop misinformation is to recognize that when it comes to neurodivergence, because remember, it's not neurodiversity, when it comes to neurodivergence, when we're thinking about people who are not neurotypical, so people who are neurodivergent, it's about recognizing that it's not a one size fits all. And I think the difficulty with the information that is out there, it's almost the information is misinterpreted, or there is misinformation because we are trying to define how a particular type of neurodivergence will show up. So I self-identify as ADHD, and to this day, I'm still learning the different ways in which it shows up in my everyday lived experience. So it's not like a kind of a set of 10 ways that ADHD shows up in your life, and then that information being online, and then every person who thinks they might be ADHD looks at that list of 10 and goes, oh, well, that's me. I think there are some very clear, criteria in that respect for different neurodivergent identities. But it's about recognizing that how they might show up for you individually is specific to you. And so that's where I think where the misinformation then comes in is what gets shared, particularly on social media platforms. People are thinking, well, it has to look exactly like that, and it doesn't. And so very often when people are sharing on social media or sharing their lived experience of neurodivergence, it's to bear in mind that it's their lived experience of it. And so it won't be a shared experience with you. Because the main thing, the thing that I've found over the years as well is that neurodivergent people, I think, are absolutely connected in a way that we find ourselves like flocking together in that respect. So I've got lots of neurodivergent friends and colleagues, but how it shows up in each of our lives is going to look different. And so often I think we reduce it down to a set of symptoms and we think, oh, it must show up in this way. So it's also giving ourselves the permission to explore for ourselves how it can show up for us. And also, because there is so much information out there, I think it's also for us to do kind of the due diligence to make sure then that we are seeking that information and that knowledge from informed, qualified practitioners and people who are informed through their lived experience. Because it's so easy for people now to say, this is my lived experience of any particular neurodivergent experience, but they're sharing their lived experience of it. It doesn't necessarily translate for somebody else who also might have that shared neurodivergent identity. So it's to hold on and to remember that being neurodivergent is not homogenous. It's not a one size fits all. I think that's the best way that we can stop being misinformed ourselves, and also sharing information that we then are unintentionally misinforming others as well.
Thank you so much. Would anyone else like to come in on that before I move to the next question? Thank you again for everyone who is commenting questions. The annoying thing about Zoom is you can't copy and paste from the chat. So I'm there typing everything out again so I don't miss anything. If you do have a question that you don't want to put in the chat for everyone to see, feel free to message me directly. So does anyone else want to come in on misinformation? And
I'd like to add something in. So I think one of the tricky things is lots of symptoms will overlap with other things. So say, for example, we look at restricted repetitive behaviour. That's one of the diagnostic terms in terms of autism. But if you look at OCD, you get restricted repetitive behaviour such as hand washing, cleaning, lining things up. They are very different conditions, but there is an overlap. If we look at, say, being distractible in terms of ADHD, that could also be trauma. So you've got some trauma symptoms and therefore you can't focus. So when you look at, say, TikTok or Instagram, Facebook, whatever it is, and you see things that you relate to, look into them rather than go, oh, well, I must have that same label then. Because yes, you might share some symptoms, but the label that would make sense of your world and your experience might be quite different.
Absolutely.
thank you so much. Oh, please do keep yourselves on mute. Someone just made me jump. I heard a shriek. Yes. Yep, sorry. Just making sure everyone's on mute. And next question. Tyra, I'm going to come to you for this one. And it's really interesting that we are an all-female panel today. But are there any gender differences in how neurodivergence can present itself?
Absolutely. I mean, you know, for a very long time, we thought ADHD was a boy thing, you know, naughty boys that come up with, you know, certain traits, and you think that that's where it was. It's only now that we're beginning to see women or girls being diagnosed with ADHD more so, and things like being impulsive or spontaneous. And related to that was very much girls are trained from a very young age to behave and be a certain way. So what comes into that from a neurodivergent perspective is the masking. We learn very quickly that if we mask, no one will see our excitability. One of the things that with autism is stimming or moving our hands and, you know, talking with our hands. I often do talk with my hands. Sometimes I don't, because it's been trained that, oh, don't use your hands too much because it's going to look weird or it's going to look strange. So, you know, it's so different between men and women. And like Jodie and Myra was saying, it comes up in different ways. And as Jodie explained, even with the DSM, although it's one diagnosis, that one thing that they're checklisting, it may be women are more likely not to be diagnosed the first time round. It might be saying, you know, many women that I've come across, it's almost like they've been told, well, you've got bipolar, you know, you've got anxiety, you've got this, but never is it sort of coming to the point where actually you've got ADHD, autism. So it very individual, massively individual to everyone.
Yeah. And I kind of want to add to that as well, that absolutely it's in how it shows up and presents. And for me, it's about in terms of the gender differences, it's not just that, yes, there is a distinction, as Thaya was saying, but one of the key things for me is learning that with all different types of neurodivergent identities, is that yes, there's the gender difference in terms of because as girls we are we are taught and parented to socialize in a particular way and to mask. But the thing that really helps me to understand then why why then girls are not as diagnosed to the rate that boys are. It's because we still have the same internal experience, but the very fact that the symptoms then are internalized themselves. So the idea of what does daydreaming or distraction look like, or procrastination look like in somebody who's ADHD or an ADHDer, it might show up externally in a boy, whereas in a girl, because we're masking, that distraction is happening internally. And so for me, it was really reassuring in a way. And it really resonated with me that when I then look at how the impact of ADHD or how it can show up, yes, I do experience all those things, but they go on internally. So somebody looking at me from the outside wouldn't have a clue the degree to which I kind of daydream or get easily distracted, or if I'm emotionally dysregulated, how much of that is actually kind of churning away internally. But because it's not being seen externally, you're then not maybe believed, or you're thought that, well, you can't possibly have ADHD. And all those myths around, well, you've got a job, you can hold down a job, you've been able to go to university, you've been able to study and pass exams. So all of these kind of classic signs for boys that would show them as struggling, girls and women predominantly are struggling to the same degree, but the struggles on the inside.
Definitely.
And that's why there's such an underdiagnosis of girls in childhood, and why we're now seeing this prevalence of adult diagnosis.
And I think
just to add to that, in terms of the DSM, it is biased. There are gender biases in the DSM. It is based on boys and men. Even if you look at service use in terms of even adulthood, women tend to go to mental health services for anxious, depressive kind of presentations, whereas men will more often go down the criminology route in terms of prison, etc., because they act out. So even in terms of services, bearing in mind a lot of people in prisons do have diagnosis of things like ADHD because of the impulse control and stuff like that. We treat people differently, even from the, looking at list of symptoms in terms of, and also in terms of how we support them.
No, I was just going to add, although some of us can be academic, but myself, as a personal experience, is very much my dyslexia would have shown up very early, but because I was Asian, Muslim, Pakistani, all of those things, it was sort of labeled as English being my second language. So, I do share that I failed my GCSEs 3 times, but it was that determination within that even though I failed, I wanted to keep going and to show the teachers that actually I can do it. You just need to teach me in a different way and I can get through. So that's how my personal dyslexic journey showed up. And then from there, it was just that, resilience or determination just to get a qualification. And also being a Muslim Asian girl, it was like, oh no, you can't go to university. No, it was like, no, let me show you I can, yeah. So definitely that comes up differently for many as well.
Yes, yeah. And I think just to add to that as well, I think it links back to an earlier question about what might be. So I think there's something about, there's the kind of the Islamic lens that we can look upon, that we can look upon neurodivergence with. There is then the lived experience of being both neurodivergent and Muslim. And I kind of really want to honour then kind of, Thyra, what you've just said, which is, this is the discrimination, this is the prejudice, this is the bias, this is the stereotypes that as minoritized identities, being Muslim and or also being racialized as black or brown, that because those particular identity labels come with prejudices around being of lower intelligence or being less academically literate. But so somebody who's neurodivergent and then black and brown and or Muslim, the struggles and challenges we experience then are put down or attributed to those other identity characteristics and not the neurodivergence. And so I think that's I think a very common lived experience then about being somebody who holds these multiple minoritized identities, that we're being we find life challenging enough being neurodivergent, we add then in all the layers of the racism and discrimination and Islamophobia. And so our struggles then get attributed to that. So again, I just kind of want to name the prejudices and name the inequalities and the oppressions that we can experience holding both types of identities along with the rest of our identity as well.
Yeah.
Thank you so much. That was a great conversation. Got too many tabs open. So the next question, I'm going to come to you, Jodie. What helps you navigate your day-to-day with your neurodivergence, neurodiversity? Even now, I'm still getting stuck over when to use what term. And I just typed something and I said neurodivergency, and then I realized that's not a word.
Anything can be a word if you will it to be. Language is always changing. So in terms of day-to-day, now I'm coming from the perspective of I am likely autistic ADHD, not diagnosed, but I work with maybe. It was actually my adult clients that outed me to myself. I didn't really know, and they were like, you're a bit. So that's where it comes from. So I suppose two things. I imagine we're going to have some parents of neurodivergent children on, and as well as adults who identify as neurodivergent. So in terms of parents, one, parent guilt will sink you. It's heavy and it's not nice, and you don't deserve to do that to yourself. You don't cause these things. They are not bad things. It just means that you've got a child that might have different sensitivities to another child. That's it. So for parents, if you've got local charities, local organisations, or even a CAMS service, which I know is a bit depending on where you live, access them if you can. Things like scaffolding your day so your child knows what you're doing now, what you're doing next, and what you're doing after that. Have it visual if you can. This is different for teenagers because they'll tell you to go away because it's not cool, which is another battle entirely. A lot of empathy as well, and being aware of their sensory needs. So if they're being a grumpy teenager, it might be just grumpy teenager, it might be sensory overload. So just being aware of those things and having that open communication. I know that's kind of a drop in the ocean in terms of children, but it's a big topic. But I'm conscious of time. In terms of adults, depends on what your presentation is. So some people like strict routine, other people like kind of semi-routine but areas of unstructured time. I would fall into that category. There are certain things that I need structuring in my day, otherwise I literally don't function. But I do need the time where there's no expectation, no demand. I can just sit and do nothing if I needed to. There's something called energy accounting. You can look this up online. It's the idea that, like a bank account, energy goes in, energy goes out, and you need to have things that will balance that energy so you don't burn out. So for example, special interests, the stereotype is like trains, planes, automobiles. Those things can give you energy, whereas spending energy might be going out to a coffee shop and having to order a coffee because you're having to interact with someone. Time management, so different things work for different people. So time blocking, where you literally block out periods of time in your diary, to-do lists, having a diary that kind of puts things out obviously for you, or visual timetables. There is actually a really helpful YouTube channel called How to ADHD, and she goes through some of the time management strategies. She's diagnosed herself, and she goes through lots of different strategies that she uses. Two last things that I can think of. Your environment at home, make it as neurodivergent friendly as you possibly can. So if you don't like the big light, don't put the big light on, get some low lighting. If you don't like smells, don't have smells. If you like smells, have smells. But put that environment so it's giving you a real sensory safety, because out in the world, you can't control any of that, and it's probably going to spend a lot of energy. When you get home, have that set up so that it's the easiest to access. Have some comfort food in the fridge or freezer, so if you're burnt out from that day, you still are eating, you're still meeting your basic needs. So those are some of the things that help me and help people that I work with, but I imagine our other two ladies have some input on those things as well.
Yeah, I think definitely, Jodie, what you're saying about structure, it's all good and fine, but when you've got ADHD traits, structure doesn't work. Timetables, people say, well, but why don't you keep a diary if you're missing appointments? It's not about the diary. You can have 10 diaries on the go, but it's just if your brain hasn't clocked that you've got an appointment, it won't happen. You know, it's those kind of things. And yes, comfort food. I was reading something yesterday. There are dopamine foods that you can have, protein, eggs, chicken, all those kind of foods are great. I think when Jamilla, you asked us, you know, what is it that you do? So body doubling. It might be that the person in the room, you just need someone there. You know, you might be procrastinating about cooking something or doing something, but just having another person sitting in the room just makes sure that you are going to do the thing that you've told yourself that you're going to do. So ADHD, dyslexia, dyspraxia, it comes up in very many different ways for everybody. But I hear what you're saying about structure. I love structure, but I'm not structured.
I have a love and hate relationship with it. Like,
Yeah.
sometimes I love it, sometimes I just want it to go away. Body doubling, though, my poor husband gets dragged into my kitchen just to stand there. Just stand
Right.
there, just be, exist, and then I can get on with what I need to do.
Yeah.
It's a common thing in our household.
Yeah. And I completely agree with, I feel so seen and heard as Jodie and I were talking about all those different things. I'm going, yeah, that is me. But I think ultimately, I think what's really important, that kind of the takeaway from, I think, this part of the conversation is, do what works for you. In our homes, we can create the environment that is going to suit us. And in that respect, it's us being in an environment that is going to help us to unmask. It's going to, an environment that's going to help us to be able to be ourselves fully, truly, and authentically. So your environment might not make sense to anybody else, but it doesn't need to. It's about it making sense to you. And absolutely going back to structure. It's not about I need to do structure in the way that someone else does. It's I need to do structure in the way that suits me. I'm incredibly visual. My walls, I'm in my home office right now, and clearly in my library. I have got stuff pinned to the walls all over this room that are visual reminders for me to be able to literally go, right, that's in that tab of my brain. But it's about creating an environment that makes sense to you. And absolutely kind of going back to the senses, like Jodie, you were just saying, it's about the smells and the sounds and the sights and what you can hear, and, you know, like noise cancelling headphones, for example. I'm somebody that I need to have some certain background noise on for me to be able to focus and do my work. Other people are like, oh, how can you work like that? I need silence. And I'm like, well, that suits me. So it's also about not feeling the guilt or the worry or the shame, even, that what you need is what you need in order to be productive in your life, and in order for you to feel that you are living a full, fulfilled, happy life. Like, do what works best for you.
Yeah. And I think, again, with the Islamic or the cultural lens, is families are not going to understand your neurodivergent ways. You know, we are going to come across very weird or strange, or why do you do the way things that you do? Why don't you do it my way? Why don't you do it this way? If you find someone stimming, they're shamed for it. You know, why are you flapping your hands? Why are you walking up and down? All those kind of things. There's so many of us that do things in different ways. But I think definitely from working with, talking to Myra and Jodie, it's taking the shame away, you know, allowing us to take, and allowing coming to therapy when you do, whoever does go to therapy, it's allowing the therapist to help you to take the shame away from your traits. You are just wired differently.
Thank you. We've got so many interesting comments, especially around the big lights. There seems to be a lot of hate for the big lights, which, you know, I get it. So thank you to everyone. And for me, this webinar is really just kind of blowing my mind. My sister always used to say to me that she thinks I have autistic traits. She's a primary school teacher and works with a lot of children. And now when you're saying things, I'm thinking, actually, no, like about the environment. I remember when I was younger, I went on holiday and I'd come back and my mum had changed my bedroom. And I was like, no, I can't do that. I can't be in this environment anymore. Anyway, sorry. But yeah, this is an amazing conversation. And the comments, you know, I'm just trying to pay attention to everything at once. This is sensory, a lot of sensory. Okay, so next question. If I can find them, here we go. Yes, this is an interesting one. I'm going to come to you, Tyra. It's to do with the government and financial support through PIP and other means for many, including those with mental health problems and other issues. Do you think this has exacerbated the stigma around things like mental illness and neurodiversity?
Absolutely. The government has a scheme called Access to Work. Not many people know about it. So if you're actually diagnosed or undiagnosed, you can apply for access to work. And this is basically a grant. You don't have to pay it back. It's money that's given to you to access things like, we talked about the headphones, reasonable adjustments at work, reasonable adjustments at home. So being able to get a chair, a desk, just different things, and life coaches, people that can help you with your day-to-day life, that structure that we talked about, being able to keep up with your timetabling, all of those things. So there are services available. So Access to Work, it does take up to 6 weeks to kick in. It's quite a long form, but there are agencies out there that can help you fill in the forms. There's somewhere that I work, it's called Send It to Alex, and they go through the form with you and they help you all the way through the process. You can also apply for PIP if you ADHD, autism, or dyspraxic, because it allows you to be able to plan things, to be able to have that extra money to support yourself. Blue Badge is also available for those who have dyspraxia, I believe. So, it's very specific, but it is given. Not enough information is out there, or people don't access things like Access to Work. But, if you need more information, that we can give some sort of tips afterwards as well and put them down. Anything that you guys want to add?
Thanks so much.
And just to add on, sorry,
I was just gonna let you guys know, please post your organization links in the chat for everyone. I know a lot of people are asking. Jodie, go ahead.
Just to add on reasonable adjustments. So reasonable adjustments, it is a legal thing. You are protected by law under the Equality Act from 2010. I once did a presentation on it as a student, that's all I remember. So essentially reasonable adjustments means that it is any adjustment that a workplace can give you within reason. So if they're going to have to spend millions, no, they don't have to do it. But if it's things like they need a workplace assessment, you need a desk assessment, you need a referral to occupational health, they can do all of those things, whether it's a debrief, mentoring, etc. But ask for it. If your employer is one of those places that you feel safe enough with to disclose these things, ask for it, because it is there in law to help you to be able to work.
Thank you. Anyone got anything else to add before we go to the next question?
Hello, Assalamualaikum. I was just going to ask the question.
Oh no, sorry, I meant the panelists.
Oh,
You might have missed at the beginning. We'll be doing the questions at around 8 o'clock. So the first hour is just some preset questions. But thank you so much. I'd wondered where that came from. Wondered who had a Scottish accent all of a sudden. But thank you to whoever that was with the question. Myra, the next question was for you. Why are we now seeing an increase in adult late diagnosis?
For a number of reasons. I think there has been a huge increase in awareness around not just neurodivergence, but neurodiversity generally. And therefore then recognizing that neurodivergence is far more prevalent than we realize. I was watching just a video earlier today, I think probably on Instagram, and something about the percentages of people that might then be diagnosed with ADHD or with autism. And I think previously, prior to a lot of this work around increasing awareness, we would have thought it was far more rarer than we think it is. Actually, it's far more common. Far more common. And so the increase in awareness around it then generates the increase in people accessing assessments, accessing diagnosis, and also self-identifying. So I think it's a bit of a domino effect. But again, it's not to say that more people now are neurodivergent than previously. We still had just as many people neurodivergent, in every previous decade or century. It's just because now we're more aware of it, more people now are identifying and being diagnosed with it. Because I think a huge myth around neurodivergence, actually, no, a big myth around neurodiversity has been what's happening in society right now that means more people are being diagnosed with it, as if it was some kind of contagion or some kind of genetic issue that only is affecting us now. And it's not that. We have just as many neurodivergent people in the world as we did in any previous generation. It's just that we're more aware of it. So an increase in awareness leads to an increase in acknowledging that it exists, and that it exists far more commonly than we realise. And therefore then it increases access to assessments, resources and support. And so that the resources and support that now exist are then going to a bit of a feedback loop, and then going to support individuals to then actually access the help and the assessments and the diagnosis. Because all of that is happening simultaneously, then there is also then a decrease in the stigma and taboos around it. Going back to kind of some of the points that were made earlier in the webinar around perhaps previously a big stigma or myth would have been, oh, it's something to be cured. And now it's and now we recognize it's not. And so there is a reduction in the stigma then to admit that you might be neurodivergent, or it reduces this, or it reduces the stigma then to go and seek for help. So that's why we're seeing an increase in adult late diagnosis, not because there are more neurodivergent people in the population. It's just we are recognizing more people who are neurodivergent in the population.
Thank you. Does anyone else want to come in there? Thank you for all of the questions that are coming in. I'm writing them down. I've also posted in a feedback form to get your thoughts on the webinar. And I've posted the link, and I'm going to post that again now. So it'd be really great if you could take a second and fill that out. Would anyone else like to come in on late diagnoses?
I'd like to add 2 points, if that's okay.
Yes.
I think that increased understanding, especially genderized understanding. Again, I know I harp on about this. Back in the day, the idea that if you're verbal, you can't be autistic, that was the way that they thought. And you can't possibly be autistic or ADHD if you're a girl. That's just the way they thought. Nowadays, we know, and we're realizing all these women have gone through. I mean, I know when I was in primary school, for example, I really struggled with maths, I really struggled with spelling, and it was like, is she SEN? Is she not? And then I got to high school and I could blend in, and I didn't have to, be centre of attention. And then I flourished, and I was absolutely fine. I've gone to uni multiple times. It's not that there was a deficit; it was that the learning style didn't fit with me. So I think that gender bias has shifted. So there's a lot of women in their kind of 30s, 40s, 50s now getting diagnosed. I mean, I've worked with people in their 70s that have been diagnosed. So they've gone through decades of not being understood to then having this diagnosis and trying to get their head around it. I suppose the other thing I wanted to pick up on is the idea of like technology and like modern life causing these things. Now, technology can cause attentional difficulties in anybody, as in with someone with ADHD or autism. Yes, it can exacerbate an attentional difficulty. It's not going to cause it. There is no evidence whatsoever that's saying scrolling on social media for 10 hours a day is going to cause ADHD. It may mean that you hyperfocus on something and you forget to eat and drink. It can exacerbate things, but it is never going to cause it, and there is no evidence to suggest so.
Very much. Jodie, the final question of our pre-prepared ones is for you. And just a reminder, I am writing all the questions down that I see. Keep them coming in the comments and we will get to them, inshallah. Jodie, how do we get younger people assessed specifically? I think there was some people, if CAMS isn't an option, or how do they, I think we see a lot of people, maybe there's a disconnect between schools and the family. So how do we kind of work together, I suppose?
It's very difficult because it's more of a postcode lottery than adults. So in the county that I'm in, which is Cheshire, in the north it's assessed in a certain way, and in the south it's assessed a certain way, and it's the same county because it depends on the NHS footprints rather than the council footprints. So as a general for children, the referral would go to either CAMS, the Child and Adolescent Mental Health Service, or paediatrics, depending on what they've arranged in that area. Like I say, in the north for us it's CAMS, and in the south it's paediatrics. First port of call for that would be the GP. The GP would take some notes and write the letter and refer over. School can be part of that referral process. Schools can be really, really helpful sometimes, and then other schools aren't so helpful. Often councils will have an independent team that is there for advice, and they're usually the ones to contact. There's also, I know for Cheshire at least, there's a parent carer forum, and that's quite a common arrangement in a lot of different counties where they can advise as parents that have been through the same sorts of things. Just to add, if you've got a very young child, so under 5, the pathways look completely different in most areas. So it is GP, and then they would usually refer on to a child development centre and assess that way, because assessing a very young child is quite a different assessment process. You can't ask lots of long questions about how they think and feel. It's more about watching play and analysing those sorts of interactions. So it really does depend on where you are. In terms of a private assessments are valid. There are some NHS organisations where they will not medicate unless they have assessed, but generally you can get referred into CAMS and they will medicate if they've got a letter with a diagnosis. The number one thing is making sure those private diagnoses are according to the NICE guidelines. If they're not according to the NICE guidelines, they are not valid. That is my key piece of information to people. There are lots of places online, if you Google, they do child assessments and child diagnoses. If it is not according to the NICE guidelines, it's not worth the paper that you paid for.
Thank you so much. Is it true that children can't get diagnosed until they're aged 3?
No. Now, it's unusual for an ADHD diagnosis that young because, I mean, if you've ever seen a 2 or a 3-year-old, they have not got any attention span, and they're very impulsive, so there's things like that that can make it challenging. But say if you've got an autistic 3-year-old who is non-verbal, doesn't make any eye contact, doesn't respond to the name, they would probably do investigations into it, but it could be lots of other things like global development delay, even like things like cerebral palsy, because that can cause a lot of SEN kind of learning issues. So there can be loads of different reasons. So it's not impossible, it's just rare that you would have a firm diagnosis of something, but that doesn't stop at 3 looking at like education healthcare plans that can support you through nursery and early years school and things like that. So it's not a barrier in terms of support, even if you haven't got a firm diagnosis. It's about having the understanding of the child so they can be put into plans and supported that way.
That's great, thanks so much. Before we get into the audience questions, would anyone else like to add? Nope. Okay. So we had a very interesting question about treatment. So how do you sit with the idea of neurodiversity and this is how I was made versus getting treatment for, whether it's medication or someone mentioned an ADHD coach. So where do you kind of sit with that? If we're all diverse and we all should kind of accept this is how I was made, but then with medication or treatment, how do you kind of sit with the two? So who wants to come in on that first?
I can. I feel like I've raised my hand. Can I answer the question? I suppose it's that thing of any condition that we have, anything that makes us us, and it can cause suffering. So, for example, I've got eczema. If I just don't moisturise, I'm going to be sore and itchy, and it's not going to be very nice. It requires maintenance. Now, that's easy because I can look at my skin and go, oh, it's red, it's itchy, it's sore, I'll put some cream on, I can see it. If I'm growing up with autism, ADHD, or another neurodivergency, one, I can't see it, so it's not like, oh, that's my autism showing, oh, that's my ADHD showing, but it could cause issues in terms of a very neurotypical ableist world, and it might be that I need to learn some skills on how to manage that world so that I don't have to suffer it as much. So that's the position that I come from in terms of if you want meds because you feel you can't function, that's absolutely your choice. If you want coaching to learn to navigate things in a different way so you don't have to suffer as much as you are doing, that's absolutely fine as well.
Yeah, I kind of completely agree with that. It links back to an earlier question that neurodivergence is not something to cure. So when we're talking about medication, when we're talking about getting coaching or therapy, none of that is in order to cure the neurodivergence. Medication, coaching, therapy, any kind of resources or support or systems or any kind of processes that you put in place are there to help you navigate your daily lived experience. It's as simple as I need a diary. Otherwise, because my working memory is such that I can't retain all that information. So a diary is a tool that I use. So in the same way that I have a diary so that I can remember all of my appointments and my schedule, in the same way that we might then turn to meds or any other type of coaching or therapy or any kind of tools or resources. And it's to hold that in mind that for me is really important. None of these things we don't access any of these things in order to cure. We're accessing these things to be able to support how we function in the world and to help us function in a way so that we can live a fulfilled life, a life that is with good emotional health and well-being.
Yeah.
So that's the distinction for me, like Jodie said, yeah.
And I think very individualized. You know, as a person, what your needs are. If you see yourself as ADHD or dyslexic, you almost know what's lacking. I know that within ADHD, there's the word deficit, but I feel deficit, not the right word. We're not deficient in anything. It's that we have too much of everything. So we've got a brain that works almost like a Porsche sometimes. There's no brakes to it. So it keeps going, and you just need someone to come in and say, hang on, have you tried this? Do you think this will work? And adapt, change, and monitor those things, and over time you adapt to your own style of neurodivergency.
Yes.
Can I just add to that in terms of ADHD and deficit, the idea that it's attention deficit hyperactivity disorder is not an attentional deficit, it's a regulation issue.
Absolutely.
So just like I forget to drink, I always have a water bottle, and all of my clients know that I always have this water bottle with me, and I always drink out the same mug because I like the routine and the feel and the sensory stuff. So it's that regulation issue. It's not that I don't have attention, it's that, a bit like what Myra was saying before in terms of having noise in the background, if you know you're going to dysregulate your temperature, your attention, then you can dysregulate to something you choose, so you can regulate back to the thing that you want to focus on. So I think the language is very loaded a lot of the time, which can add to the stigma around things.
And that goes back to also that thing about it's not a one size fits all. I'm in the middle of training as an ADHD coach, and the idea that, and actually then but also being somebody who's an ADHDer, I'm looking at all this stuff. I mean, I'm trained already as a therapeutic coach as well as a therapist. But in looking at the ADHD material specifically, it's like looking at all of these different ways in which I can support a fellow ADHDers. But it's not about going, right, every ADHDer needs every single tool that's now in my toolkit. It's very much on an individualized basis. It's what do you specifically need help in? And again, I think that's part of kind of the self-compassion piece for me. That's also part of the self-care and self-worth in being neurodivergent, which is I'm acknowledging where I need additional support or help, or systems in place or structures in place to help me, and I will then go and access that or do that for myself to help myself, as I said, be able to kind of navigate a daily life that can sometimes feel incredibly challenging.
Thank you all. The next one kind of links to the question we've just spoken about. As neurodivergent numbers increase in society, what happens to the concept of typical when members of a large sector or society are not typical?
I can speak to this because
I like Jodie's face with that.
Cool. Yeah. I can speak to this because the labels, or I'm going to use the word spectrum, but I don't mean it I don't mean spectrum in terms of in the same way that we might call like an autism spectrum, like that. I'm not talking about spectrum in that respect. I'm talking about maybe a scale. See, this is ADHD live in action. I've lost my train of thought is gone. So yeah, talking about the idea that the more people that get diagnosed as being neurodivergent, then somehow then what is seen as neurotypical or neuronormative is actually going to be a minoritized identity in a way. We've got to remember that the very reason why we have this spectrum of neurodiversity is to be able to distinguish between a dominant identity, which has been labelled as neuronormative or neurotypical, and at the other end of actually a spectrum of oppression, at the other end, we want to be able to push everybody else that's not neurotypical or neuronormative. All those people then that would come under the label of neurodivergent, we're going to place them as a minoritized identity at the oppressed end of the spectrum. So what we're really talking about here is structural and systemic inequality. Every single aspect of our identity has its equivalent spectrum of oppression. When it comes to racialized identity, when it comes to gender, when it comes to sexuality, when it comes to age, when it comes to every single part of our identity, there is its equivalent spectrum of oppression. Where at the power end, at the powerful and privileged end, the identity that sits at that powerful end is the dominant position. So if we do the equivalent for, let's say, racialized identity, what gets positioned at the powerful end of the racialized spectrum of oppression is whiteness. What gets placed then at the oppressed end is the minoritized communities of being racialized as black or brown. That doesn't happen by chance, that we all collectively decided that whiteness has all the power and black and brown racialized identities have no power. It's born out of oppression. It's born out of systemic inequality. In just the same way that the neurodiversity spectrum has been born out of that same structural inequality. Because in society and over time historically, what gets seen as neurotypical and neuronormative is a certain brain type. And that brain type self-identified as neuronormative or neurotypical. And it essentially said, anyone then that is not like us, anyone who is not neuronormative is then going to be neurodivergent. So the words and the language that we're using does not equate to the actual quantitative figures in the world. Just because, so this idea that neuronormativity or neurotypical, they might not be the majority in numbers, but they take up a dominant supremacist position and therefore place everyone else at the oppressed end of the spectrum. So the labels that we're even using, the idea that we're saying that neuronormativity or neurotypical, we've got to recognize that it is actually a word born out of supremacy and born out of oppression and structural inequality. That's why there is so much about how we use language. So it's really important for all of us to recognize that when we talk about a dominant identity, we're not talking about a majority necessarily. Talking about that particular identity has been defined as the normal identity, got nothing to do with numbers of people.
Great explanation, especially when it comes to, I think, people always say, oh, the BAME population of places is increasing. So does that mean racism doesn't exist? Well, no, the structural mechanisms still exist. Yeah, apologies, I'm dog sitting a very needy dog, so that's what you can see on my lap. He likes to make an appearance. Does anyone want to come in, or shall I move to the next question?
Can I add one thing? Executive dysfunction, which is one of the ways that we assess ADHD, autism, etc. Basically, there is no like, this is executive dysfunction, this is executive function. Executive function is generally the functions that the brain has that are sat in the frontal lobes of this part of the brain. It's things like memory retention, task initiation, problem solving, those sorts of things. And essentially, we just move the line to say what's functional and what's dysfunctional. That's all that happens. So if we look back at, say, the late 80s, 90s, when I was little, the line was in a different place, and now that we're in more modern times, the line is in a different place again. So depending on where we put that line depends on how we say, well, that person is dysfunctional and this person is functional. So again, it's that power play of this person is within the powerful sector. It sounds like Hunger Games, and these people are in the non-powerful sectors.
Very interesting. Thank you so much. Next question, trying to see on my list. Do you think it's fair for a severe non-verbal adult ASD individual to get another label as those with mild symptoms also get the ASD label, and it can be confusing to explain that? So I think it's talking about someone who's got severe and someone who's more mild symptoms. Go on, Jodie, you got it. I don't need to explain.
So the language on mild severe, that's problematic. Again, that's oppressive to say that someone who presents as mild therefore doesn't suffer like someone who presents as severe. We're saying they're both autistic, and that's absolutely fine, and they have different needs. So different support needs is the kind of language that we're using at the moment. The idea that you're mild because you're verbal or you're mild because you can work is problematic. It's a bit like saying, well, you're less disabled because I can't see what's going on in your brain. Whether it's fair or not, it's about support need. And no, services aren't fair. They aren't. We know that the mild autistic people generally don't get support. So, for example, in Cheshire, I was one of 2 counsellors for autistic adults. Funding has just stopped. There is no counselling in Cheshire for autistic adults at all. It does not exist. Whereas if you are learning disabled, severe autism, there's lots of services that you can access here. So no, services aren't fair, but also the language is really, really important, because that, what's the word? Not extrapolates. Perpetuates that unfairness. The idea that, well, you're mild and this person's severe. It's, be careful of language, I would say.
I think just to add there that it's as psychotherapists we can help, but we don't diagnose. We are there to facilitate, but it is the psychologist that are more trained to actually give us the diagnosis. But saying that, as psychotherapists, we have a particular toolbox. Myra said we've got the lived experience, we've got the ability to be able to work with your narrative and work with the difficulties that you're having, you know, as you're sort of navigating this new me, because you've had to mask for so long. So, you know, there is so much more to this than just this discussion itself. So I think that's really important to point out there. And, you know, within the community, that therapeutic community, there are some amazing psychologists that can help you to get the diagnosis as well.
Really interesting. And I think it's definitely good to be mindful that, similar to disabilities, we don't know what's going on within someone. You know, there's a big push for invisible disabilities, being aware of that, you know, where there's that badge that you can get for public transport that says not all disabilities are visible. And I think that thinking needs to move over to neurodiversity and neurodivergence. So thank you for those answers. Is there a point of getting diagnosed late if you just go to your GP and then they just give you medication? I think the person asking the question was kind of saying, well, if you get diagnosed early, you get support, you know, through school, through university, through work. So is there a point to getting diagnosed later in life?
I mean, in terms of medication, a GP cannot give you stimulant medication for ADHD. That comes under a psychiatrist. So if you want medication for that, yes, you would need a diagnosis. The sad thing is postcode lottery. So for certain services, you need a diagnosis to get in and use services. For other services, like our local one, you need to be on the pathway for diagnosis to access most of their things for adults. Depending on your area, yeah, it might not actually pay to have a diagnosis unless it makes sense of your experience and helps you on your journey.
And I think it's such a personal choice as well, that as people start to be curious about their lived experience and curious about or questioning about might they be neurodivergent, that it's for them to individually choose then whether they want to go down a formal assessment route or not. We appreciate that there's kind of lots of barriers around getting a formal diagnosis, as has been discussed in this webinar already, and very long waiting lists and things like that. I think it's also about actually coming from a position of being a coach and an ADHD coach. It's about thinking about what I would invite somebody who's thinking about, is it worth going for a diagnosis, about what is your current relationship with identifying with that diagnosis. What would a diagnosis give you? What might be fantasies in a way about what might be on the other side of a diagnosis? And so I think it's really helpful to be able to figure out for yourself what it is you think you're going to get with a diagnosis. Very often a diagnosis opens the doorway into then getting the resources and support that that person needs, and they feel that the diagnosis offers them a legitimacy to ask for those resources and support. And so I think it's, again, just being honest about saying, actually, that is going to help me get resources and people are going to take me seriously. And it means then that when I approach a particular charity or coach or therapist, I feel much more confident in saying that this is who I am. Because there are, I think, lots of reasons why people might want to get diagnosed. And I think often it's about validation. I think it's about validation of their lived experiences and looking back with hindsight, making sense of their life experience up until this point. And I can really resonate with the idea that, yes, it's not only validating, but also it's about, oh, this really resonates with me. It offers me a sense of belonging. It offers me a sense of, oh, this is making sense of my lived experience that is actually really common. So many people feel so isolated in their neurodivergent diagnosis or in their self-diagnosis. And I think by going for either formal or informal diagnosis or self-diagnosis, it can offer you a greater relationship with yourself, but also can offer you means of getting access to support and particularly access to community. And I think for me, what has absolutely been so beautiful about this webinar is the number of people that have disclosed in the chat that they are neurodivergent and Muslim themselves. And for me, it's about offering these spaces to be able to recognise that there are many, many neurodivergent Muslim people, and to be able to say then that you're not on your own with that intersectional identity, and you don't need to suffer on your own with it. And many of us then have over the years and figured out ways to help ourselves that we can then share with one another and support one another for other people to be able to help themselves as well.
Yes, thank you. And we've had a really good comment that says it's important to remember that diagnostic reports come with recommendations about how to cope at home, school, and work. So I think that's really good to keep in mind, that it can help you with coping mechanisms, in addition to what our panelists said. We've got a lot of interesting conversations happening in the chat. Oh, please keep yourselves on mute. Oh, I can't get there fast enough.
I've done it.
Thanks, Moira. Okay, so the next question: how can you speak to a child about their diagnosis of neurodiversity? My brain wants to say neurodivergency, but if I say that, you know what
if it's a word, it's a word. If it makes sense and we all get it, it's a word. My experience of parents is kids don't have any shame. They're not bothered. Just explain that that's their brain and that's okay. I think it's tricky with teenagers because they've got a certain formulation of what's normal and what's not normal, and that can be a bit trickier. I mean, if you ask my son, he's 7, he's not diagnosed, he's never been assessed, he's home educated, he's not in school, he's definitely ADHD. We just talk about having different brains. And do you need a brain rest? And he goes, yeah, I can't concentrate, I need a brain rest, because his concentration's around 8-10 minutes and then he's done. So just talk about it. We all have different brains. You know, mummy likes this, daddy likes that. What do you like? What works for you? It doesn't need to have a shame thing attached to it. It's not like oh gosh, you know, you've got this really bad diagnosis. It's just, we understand this bit of you because we happen to have some help understanding. That's all it is.
And it's almost in the same way to say, well, we all look different.
Mhm.
We all have different, you know, there's a whole range of different shoe sizes, clothes sizes, different eye colors. It's no neurodiversity as an identity characteristic is no different to the range within that identity characteristic next to any other identity characteristic. So just as there is a range in age, in shoe size, in dress size, in eye color, there is also that range under the identity of neurodiversity as well. So I think often we relocate this identity of neurodivergence and neurodiversity as something separate and something that is about whether you are healthy or non-healthy, whether there is something wrong with you or not. And actually, neurodiversity as an identity characteristic makes it part of our identity, and the diversity within it as any other aspect of our identity as well. And this is a lot of what I teach in my work on working within diversity. Neurodiversity then is one of a whole handful, a whole identity wheel of identity characteristics. And there is as much diversity within that as there is diversity within any other aspects of our shared identities.
And again, just the emphasis and another layer, it's a blessing, you know, it's a blessing to have a brain that works differently. It's a blessing that we can think outside the box. You know, I often refer to it as like a common sense brain. You know, you might meet people that really don't get it, and you're there in a quick second. Oh, I got it straight away. So different brains just mean different blessings from all that. So.
Yeah. And linked to that, someone wanted to know whether or how can you deal with parental guilt over delayed recognition and diagnosis in a child, and what kind of harm can that do to the child in question?
Totally zoned out on that question. Can you repeat?
That's okay.
So my time limit, my brain just
how can we deal with parental guilt over a delayed recognition and diagnosis in a child, and can that harm a child in question?
No, you're not going to harm your children by not knowing stuff. You know them. Just because you didn't have a label to make sense of it doesn't matter. The main thing is your relationship with that child. And often we've got neurodivergency in the generations above us, and it's just accepted as a norm because you didn't need a label at the time and now you do, and that's okay. Be kind to yourselves. So many parents I work with are full of shame and guilt around how they've harmed their children. If you had a crystal ball, I imagine you'd go back and change some things, absolutely, but you don't. So the only thing you can do is draw a line on it and go, so how am I going to do things differently moving forward?
Yeah, I think that's really good way of putting it. Thank you. I'm going through these questions. We've got 7 minutes left, so I'm going to try and get through as many as possible. So this one's kind of 2 in 1. What are some common challenges you see about navigating Muslim contexts as a neurodivergent person? And I think linked to that, someone asked how they can manage their prayers because they might miss them more often due to their neurodiversity. So whoever wants to come in is fine.
My immediate thought to that is engaging in Muslim spaces as a neurodivergent Muslim. I think for me, this is through my lived experience here. I think it's about feeling for whether that space feels safe, and for whether that space is going to be able to hold and be respectful of diversity, like more broadly, not just about neurodiversity, but about the diversity of our lived experiences. And part of that is a concept that I call the two truths concept, which is in any given relationship between us and the other, and with us and an other person. For any given relationship where there are two people, there are two truths simultaneously present. I have my truth in my lived experience, and the other person has their truth in their lived experience. And The two-truth concept then, which is kind of something as part of in our therapeutic supervision coaching relationships, is as a practitioner, I'm holding two truths simultaneously, mine and my clients. In spaces generally, and that includes Muslim spaces, I think it's about spaces that can foster the ability to hold multiple truths at the same time. And for me, it's then about going, can we hold that I have my truth, my lived experience, and that can be held to the same level of acceptance and sensitivity and value and respect and honor as anybody else in this space. So right now, we have obviously a lot of people on this call right now. For however many people are on this call right now, there is that equivalent number of truths. So can my truth in this space be held with the same level of value and respect as each other's? So if I'm talking about feeling unsafe in this space, can that be accepted as opposed to dismissed? If I show up and feel like, and in this space say, I'm feeling really overwhelmed right now, does my feeling of overwhelm, is it being honored? Is it being looked after? Is it being thought about? Or in a relationship or in any space, is my experience in that space being thought about? And so for me, when we're talking about being Muslim, when we're talking about being neurodivergent Muslims in Muslim spaces, can my lived experience being neurodivergent, can my truth be fully acknowledged and accepted? And often that is going to show up in how I show up in that space. Am I okay to be a bit quiet one day? Or is there other expectations on me to show up in a particular way? And this, I think, again, is gendered. As women, as Muslim women in spaces, the level of expectation and projection of how we are meant to show up in these spaces are often the opposite of how we would want to show up. So I think there's something about what is being put upon us, the challenge of how we're expected to show up very often does not align with how we want to show up and how we can show up in spaces. And I wish that was really held in mind.
Thank you. Thank you to everyone who's been commenting. There's some very interesting discussions happening. Just want to say we are all here to learn. I think a lot of us have come maybe not knowing things that we now know, especially around language and how to talk about neurodiversity. So we're glad that we've provided this space in order for learning to happen. I think sometimes when we write things, you can never sense tone. That's why I always prefer to call instead of texting someone if I need to talk about something. It's really difficult to sense tone. So please try and be understanding with each other. We're all just trying to learn. I'm going to put the feedback form in the comments again. And as we've only got 2 minutes left, a lot of people have been asking about resources, where they can learn more, where they can train. So I'm just going to go around and give everyone a final chance to talk about the work that you all are doing, the amazing work, and plug any resources that you have. Myra, over to you.
I run my own private practice that includes therapy, counselling, supervision and coaching, and that can be found on my website, myrakhancounselling.co.uk. And of course, I absolutely want to give a shout out to the Muslim Counselling Psychotherapists Network. That's the mcapn.co.uk. And on there, we have both a Muslim counselling directory and Muslim supervision directory. Everyone listed on the Muslim counselling directory are all vetted, so they are all qualified and registered with a professional body. So to ensure that you are working with somebody that is fully trained and accountable and works to an ethical framework, please go on to the MCAPN counselling directory.
Thank you, Jodie.
So I'm also in private practice. I'm also on the MCAPN. That's always a mouthful for me. My primary work in terms of neurodivergent work is neurodiversity.com. It is a practice that I run with my husband, who is autistic. So I offer therapy and coaching for adults or parents, and he tends to work with younger people from a more kind of practical standpoint in terms of learning, coaching, that sort of stuff. So get in touch if you do need anything.
Thank you. And last but not least, Tyra.
So I am in private practice. So I've got a private practice, it's called TY Khan Counselling, but more importantly, I'm working more and more with neurodivergent people. So I have a website called The Neurodirectory. Basically, it's a platform for all people that are neurodivergent to come on there to, to be able to find other neurodivergents as well. I'm also building a Facebook group. I'm also sort of talking, opening the conversation. I do mentoring for ADHD and autism. So, there are so many resources out there. We just need to be able to find them. Thank you.
Amazing. Thank you all so much. Thank you. And thank you to everyone who has joined us today. We've got the feedback form in. If you want to see more webinars like this, then please do fill it out. And thank you again for coming. Inshallah, you have a great rest of your evening. Thank you so much. Assalamu alaikum.